and then two, they're not always proactive about the things Black people or African people need to do when it comes to their health. So my presentation is going to be along this format. I'm just going to do a brief introduction. We're going to talk about the common health concerns. We're going to talk about three main concerns that we need to be well aware of. Those are the ones that are the commonest, and those are the ones that tend to happen fairly frequently. And because they happen fairly frequently, those are the ones that we need to pay attention to the most. I'll discuss about other concerns, okay, before I make my conclusion, and I'll leave space for questions and answers. All right. So when we talk about common chronic diseases for Black people, number one is hypertension, and that can include things like stroke, heart attack. Number two is type 2 diabetes. And then the others that can include cancer, sickle cell, and asthma. Now, the reason why I brought up sickle cell is a lot of people, even till when they are 40, do not know that they are carriers of the sickle cell trait. And it's later down the line that they now find out that this can be a problem. Okay, so it's a recommendation for everybody to have their blood type and genotype done by the time you're 40. Even if you don't have any issues, it's always good to have this done, okay, because it leaves a framework, a baseline framework for health decisions that are going to be made up later down the line. Okay, so your genotype, your blood group must be done. Now, we've mentioned something about hypertension, but when we talk about chronic heart disease, they're looking at things that can um, that come into play. You know, I've written CVA there, and in bracket, it's a stroke. CVA is the medical term, is what we call cerebrovascular accidents. Okay. And they can be of two types. But we'll dwell into that later. Then we've talked about myocardial infarction. That's also a medical term, but it's that's what we know as heart attack, when someone just grabs their chest. And then there are a whole range of cardiomyopathies that affect the heart, especially, and can cause things like heart failure. And the patient doesn't need to be hypertensive before that needs to happen. But all of that we will discuss in one shape or form. The, the second thing we're going to talk about is type 2 diabetes. Now, type 2 diabetes is what everybody knows diabetes is, oh, people presume that your body is not getting enough insulin. But what tends to happen with type 2 diabetes is your body might be producing it, but what is produced is no longer sufficient for your body, or because of some other conditions, what you were producing at a higher level before, all of a sudden the the level stops and it gradually drops. Now, the gradual drop in your production of insulin can actually normally happen. The body breaks down as we get older. So it's not unusual that what was functioning when you were 20 and 30 is is beginning to slow down its function once you're 40 and above. I take a glass of water. So all of these things can come into play. Then we're going to talk about cancers. Cancers are very important because, um, especially for the women, breast cancers is the leading cause of non chronic condition deaths for black women. So what that means is this: if you don't have any other chronic condition, the number one cause of death for black women is breast cancer. So that is something that is serious and should be taken very seriously. And we're going to talk about that today. For men, we're going to talk about prostate cancer. Now, prostate cancer is unique because when it comes to cancers, it's not the first, but for Black people, after lung cancer is the number one cause of, of death in black men. And then we're now seeing a resurgence or a new spike in what we call colon cancer. Now, when we talk about colon cancer, people don't always understand what it is, but when the best example I can give you is Chadwick Boseman, a relatively young guy in his 40s, and you can see what happened to him. So it's the same condition that killed him, colon cancer. So these are things that the spikes are coming regularly, and we need to be well aware. There are other conditions that we need to talk about: peripheral artery disease, VTEs, which is what we call swollen, where your legs become persistently swollen as you get older. All those conditions can be helped with. Now, when we talk about high blood pressure, the key markers are what we call the diastolic and the systolic pressures. Now, the systolic pressure is, for easy term for everybody to understand, is the number that is always the first one. Okay. The diastolic is always the second one. Now, any by the American Heart Association, any blood pressure above 140/90 in someone 40 40 or younger, any blood pressure above 140/90 in someone 40 or younger is high blood pressure. Let no one delude you into, oh, it's normal 140. Once it's 140/90 or is above that, that is high blood pressure. That is high blood pressure, and it needs to be taken very seriously. Now, the at least the the least control we should have for that is, even after you've gone to see your doctor, is and you're taking medication, really should not be above 130, 85 millimeter mercury. That mmHg is millimeter mercury to be. That's how we measure the high blood pressure. Okay. Now, if you notice, I have said make sure other investigations are carried along, especially the kidney function test. You know, and what happens for a lot of us, okay, especially when we're abroad, is, oh, we're told we're hypertensive and we're started on medication. Now, for Black people, the antihypertensive medications that work for Caucasians and work for other groups of people are not as effective for us. Okay? They are not as effective for us. What has been noted is a lot of the higher blood pressures in Blacks or Africans is what we call fluid-based high blood pressure. That means that the circulating volume in the blood is high. Okay, it's fluid-based high blood pressure. That means that those medications that are effective for Caucasians have little to no effect for us, or they have minimal effect if they have any effect at all. So, if that's the case, and your doctor is managing you for that, and is not actually looking at other causes, that might be a problem. Okay, because like I said, since our high blood pressure is more fluid based, and the kidneys is where all the fluid transaction in the body takes place, you can imagine that there is a correlation between high blood pressure and kidney damage. So for any person that is hypertensive and has gone to see his doctor, they at least they must do a kidney function test. It's a must. They must do a kidney function test, and it must be reviewed by your doctor. Okay, it's critical that that happens, because if you don't do that, the kidney might be damaged, might be being damaged as the blood pressure is not being well controlled. So it's very critical that the kidney function is looked at. There are other baseline investigations that needs to be done, because obviously the high blood pressure does not only damage the kidney. The high blood pressure can damage the whole body. It can damage from the heart, from the eyes to the skin. It can damage everything. Okay, it can damage the liver. It can damage the gallbladder. It can damage everything. Okay, but like we said, it's the same high blood pressure that can cause what we call a stroke, what we call a heart attack. Obviously, when we talk about stroke, we're talking about damage to the brain. When we talk about heart attack, we're talking about damage directly to the heart. So you can see how high blood pressure can affect um, the whole body. It can even affect the eye. It can cause sudden blindness. There's something we call retinal detachment, sudden retinal detachment in poorly controlled hypertension, where if you're not taking your high blood pressure seriously, you can just suddenly lose your vision. Okay, and the surgeries to repair those kind of conditions, they are in the millions. If you're in Nigeria, they are in the millions. Last time I checked, to do a retinal detachment procedure is like about 5 million naira, and you have to do it within the first 72 to the first 3 to 5 days. Those are where you can get the best result. Anything after that, you might not get your vision back. Like I said, the American Heart Association says the blood pressure that we consider good blood pressure is at least 120/80. Now, some of us already have parents and they already have high blood pressure. I am not recommending that you get their blood pressure to 120/80. Okay. What has happened is in those patients, their body is already used to a fairly higher level of pressure. If you dramatically reduce theirs, that's going to be a problem for them. But when we talk about for us in this age group, we want to look at that 120/80. What that does is if we can achieve that goal of 120/80, the likelihood of increasing the blood pressure as you get older reduces. The likelihood of damage, high, hypertension cause reduces as you get older because you have very good blood pressure. Okay. Now, obesity too can contribute to high blood pressure. You know, so we need to do things like reducing our meat intake, um, fish, chicken, grilled, not fried as much as possible, and reduce the portion of our carbohydrate heavy foods. We're Africans, we love the carbohydrate heavy foods, the ebas, the amalas, the jollof rice, you know, and then regular exercise. Now, when I say regular exercise, um, what people misconstrue that for is I'm saying go to the gym. If that can work for you, fine. But for a lot of people, that is not always easy. What recommendations I would give for that is regular exercise, repeated regular exercise in the shape that you can continue without issues. What do I mean by that? I'm talking about taking walks, 30, 40-minute walk, but at a fast pace. A fast pace convenient for you, not convenient for any other person, but convenient for you. So you might need to start slow and then you build that up. I'm not saying, okay, you're now hypertensive, go to the gym and be going to lift weights. That might not be that is definitely not what you need, but you need to work out the heart in a fairly regular manner. Okay. That's why it's important that it is cardiovascular, the cardiovascular system is strengthened and it's regular, So it's not something you do once a week. If you can incorporate it at least 3 times a week, it will be great, you know. At least over the course of a week, you're looking at least 150 minutes. So if you do that, like I said, 3 times at 30 minutes a pop, you're doing 90 minutes. But if you do it for 5 days in a row, that's 150. So balance it out, 45 minutes over 3 days, and you get the same figures. All right. You know, like I've mentioned before, the medications that are effective in Caucasians have little to or are less effective for us blacks or Africans, you know. And then the two main drugs that we need to know about are what we call calcium channel blockers and diuretic. Diuretics is works on the fluid part of the process. Now, like I've said, because a lot of blacks and Africans, their hypertension is more fluid based. If the doctor managing your blood pressure is not giving a black person a diuretic, is doing you a disservice. A diuretic must be in there. It must, is a must. They can give you 2 or 3 medications, but if it's not giving you a diuretic, they're doing you a disservice. And at least one diuretic or at least a calcium channel blocker. Now, you don't need to know what a calcium channel blocker is, but it has been shown to be the most effective group of medications that are most effective for Black people, the calcium channel blockers. So if it's the first time you're meeting your cardiologist or first time you're meeting your doctor, it might be something you might need to request from him for him to start. But the calcium channel blockers are known to be the most effective for Blacks and African people. Now, like I've said, your CVA is just it's just like a stroke in the brain. But there are two types. There is the blood clot type, and then there's the bleeding type. We're not going to go into too much uh, details, but obviously, one requires that the vessels in the brain is either blocked or is torn. So if it's blocked, there is no blood flowing to the area of the brain. Or if it's torn or ruptures, that means there's still no blood flowing, but the blood is flowing directly into the brain cavity, which is a different ballgame entirely. So each one has its own issues, and each one can happen with high blood pressure. It's like you increasing the pressure of your hose. After a certain while, the hose might just suddenly tear. The hose might just suddenly tear. Those are the kind of things that can happen in the brain, so that the blood vessels can suddenly tear because of the very high blood pressure. So all these things, we don't want to get into that, because the consequences of them, the sequelae that happen after a stroke, they are a lot more difficult to happen. Why? Because obviously, if there's a blockage, if there's a rupture of the blood vessels, the area of the brain is not getting oxygen and can suddenly begin to die off. Now, obviously, the brain controls every part of what we do. So if a certain area begins to die off, you can imagine the consequent effect on the body. So we don't want to get into for it to get into a CVA. We don't want for it to get into a myocardial infarction. That's why we're talking about what we're talking about today. Moving on. Okay, so I've spoken about myocardial infarction. So in 2019, the US Office of Minority Health, their data shows that African Americans were 30% more likely to die from heart disease than whites. And African American women, Black women, are almost 50% more likely to have high blood pressure compared to their white counterparts. So you can see it's not a case of just us of us just looking the other way. These are things that directly affect us. You know, the 30% more likely to die because they're not giving you the proper medications, they're not doing the proper tests for you, or they just you're because they think we're not going to ask questions. You know, things get uh, lost in the ether, as they say. So it's very, very important, because these are the kind of things that can cause, like I said, the chronic kidney disease. I've talked about retinal detachment. I've talked about some of these complications. So it's very, very critical that, especially for high blood pressure, that kidney function is checked, and that, like I said, the two main classes of drugs, at least you must be on one. At least you must be on one. Okay? This is just me showing you what the heart looks like. You get, all the major vessels, so you can see that. Now, we're talking about type 2 diabetes. Like I said, for type 2 diabetes, it affects the production of insulin in the body. Now, when you're younger, you know, the production of insulin is normally there. If you're young and your body is not producing insulin, you're diabetic, that's type 1 diabetes, okay? But as you get older, sometimes, because of obesity, you know, you develop type 2 diabetes, or because of inactivity, the kind of job you do does not allow you to walk around enough, you know. So all of a sudden you're very obese. Now, because the production of insulin is affected, the blood sugar level will significantly go up. Okay, and it tends to occur, like I said, in middle age, which is where we are going to, 40 and above the age group, or if there's a family history of diabetes. Now, because there's a family history of diabetes does not mean that you will also have diabetes. If you do some critical things, if you do some critical things, it can help delay diabetes or prevent it if you're very aggressive. And like we said, you know, blacks were twice as likely to develop type 2 diabetes than Caucasians. Okay. And that number gets worse if we're not proactive. You know, some of us are obese, some of us are very obese. And it's not only about being obese, it's about our sedentary lifestyle. We're very obese and we're not as active as we should be. And that's very critical. The less active you are, even the insulin that you produce might not be effective. You might be producing the normal insulin, but because you are not active, that affects um, the way the insulin affects the sugar in the cells, you know. So, and something that's been noticed with more fat cells overall, that means in very obese patients or morbidly obese patients, the insulin is affected. The insulin is affected from getting to the periphery by those fat cells, you know. So it's critical that some of these lifestyle changes must be done, you know. Obviously, if you're morbidly obese, if you are very obese or morbidly obese, you losing a significant amount of weight can even move you from being pre-diabetic to normal, or being a classical diabetic patient to a pre-diabetic patient, you know. So it's critical that some of these things and our physical activity must improve. And then our our diet must be plant-based. What do I mean plant-based? You know, I'm not saying you shouldn't eat any other thing. I'm saying the amount of, you know, fruits, vegetables, salads must increase, you know. So if you're the kind of person that likes a lot of meat in your diet, you might have to move to things like beans and alternatives, you know, like tofu, so that you can get the benefit of the plant-based proteins, because they are more difficult to digest, okay, and to convert to glucose. Obviously, the less glucose the body converts, the better overall. So what is critical to understand for diabetes, for type 2 diabetes, is once you are diabetic, the problem now becomes what we call a small vessel disease. Now, everywhere in the body, we have small vessels. You know, we know we have the arteries and the veins. But as we get smaller, you get to the very small levels where they cross from being the arteries to the veins. Now, diabetes affects those vessels, those small vessels. It causes extra deposits to be formed in those vessels. Now, what that means is this: once those deposits are formed, those small vessels become completely useless. Now, because they become completely useless, they are no longer viable. The body is going to try and create new blood vessels, but they are not going to be as good at what was there initially. And that is where the problem now comes into play, because the new blood vessels that are created are essentially, most of them are essentially useless. You know, something that was doing 100% of work, by the time the new blood vessel comes into play, it's doing like maybe 15% of work. So you can see that the consequent damage is going to be very dramatic. And that's why it's very key for prevention of type 2 diabetes. It's very, very critical. Now, we've talked about the two most commonest concerns. The third one is cancers. You know, the three commonest cancers, like we said, number one cause of commonest cancer across the world is lung cancer, and I can I can we can understand why that is. The lung is one of the most, after the skin, is one of the most exposed organs in the body. We're breathing in pollutants, breathing in smoke, we're breathing in so many hazardous material. You know, you go to a work site, if you don't have a mask on, a rebreather mask on, you're breathing in so many toxins, asbestos, and so on. So it's not unusual for it's 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 very understanding why lung cancer is the most commonest cause of cancer. Now, that being said, what my number one worry is for the age group of 40 and above immediately. Now, it's not like lung cancer doesn't affect the 40 and above, but the range is from 25 to 65. So it could have started at 20, it could have started at 30, it could have started at 45. That's why I'm not harping on lung cancer. But for women, the commonest cancer is breast cancer. Is breast cancer. Now, for African Americans and for Black women, the rates of diagnosis of breast cancer is significantly higher at later stages. What do I mean by that? So it is more common for Black women and African American women to get diagnosed of breast cancer at the stages where it is, one, more difficult to operate, and two, more difficult to manage or to cure, you know? And that's because, number one, there's a lack of awareness about this. And number two, there's also a lack of how you you self-examine your breast. Now, for the women in the group, self-examination of breast is important. But I will also recommend that you should also educate your partners also in self-examination of your breast. The reason is this: they might actually be more aware and pick out something a lot quicker than you might, because it's your body. We always disregard so many things when it comes to our body. So your partner might be easier for your partner to do the examination and pick out something different that needs to be checked out, even if it's a small lump. You know, once you've been, once you've once you've had children, or you, especially if you've been on any kind of um, hormonal replacement therapy, or been on any kind of hormonal replacement therapy, you need to do your breast cancer screening, and and that can that can be mammo that can be mammograms. That can be the number one thing to do is mammograms, okay? Or you do a breast scan, a breast ultrasound scan, okay? We do a breast ultrasound scan. Now, for men, the alternative is what we call the prostate cancer. Is After lung cancer is the most commonest cancer for men, and it needs to be taken seriously. Now, the thing that is the most important thing for prostate cancer is there's a blood test called a PSA, and then a digital rectal exam. Now, the digital rectal exam, people are now shying away from doing it because it can alter the PSA results if it's done properly. But there's also what we call a transrectal um, ultrasound scan. So that can be done, and it can be done very easily without a lot of discomfort. And please, 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 once you're above 40, the PSA is something that you need to be doing at least once every other year. And if you have a family history of prostate cancer, once every year. It is critical. And what you need to look for men is a change in your urinary behavior. What do I mean by that? Is if you're when you urinate, is it stalled? Is it, do you feel like when you urinate, the voiding is not complete? These are things that are critical to what we're talking about. And we talked briefly about colon cancer. Now, colon cancers, there are three things you need to look at, you need to look for in colon cancer. One, are you seeing blood in your stool? When you go to use the toilet, do you see blood in your stool? If if you don't, that's fine. If you go to the bathroom and you feel very pressed, but the amount that comes out is very, very little, that needs to be a worry. If how you, if the stool the normal color of your stool, if it dramatically changes from the normal color to black or any other color, that can be another significant thing to worry about. And then your normal habits. Maybe you go to the bathroom once every 2 days, and all of a sudden you're now going to the bathroom 3 or 4 times a day. That is a dramatic difference from what you're doing, and you need to come in and get your colon checked. We talked about sickle cell and how it can affect all the organs in the body, and it's very, very important as for us to find out, because if we are carriers, that means that we can expose our children to it, and it's very, very important that we don't pass some of these things along to our children. Now, one of the last things I'll talk about is asthma. Now, asthma, people take it for granted, but it's something that, especially for Black people, is one of the causes of comorbidities. What do I mean by that? You know, people take it for granted that um, oh, I'm asthmatic, I have my inhaler, but there are so many things that can happen. You know, if you're asthmatic. You can be in a place where you are being regularly triggered, and if you're not very careful, that can cause a very significant episode. And like I said, because Black people are not taken seriously, this can lead to morbidity. So that's why it's very, very critical. And it compromises airways. Now, our last two concerns, which I'm going to push to the women because it's them that tends to get this a little bit more than men. It's what we talk about um, peripheral artery disease and venous thromboembolism. Now, both have to do with swollen legs. One is easily manageable. The other one is a critical emergency. Okay, both has to do with swollen legs. Now, in venous thromboembolism, the legs get swollen, but there is always pain around the calf or the thigh. There is pain around the calf or the thigh, the area that is most swollen. Those are critical emergencies because a thrombus has formed, a big clot has formed in those vessels. Now, those because those vessels take blood from the legs back to the heart, they tend to be very, very big. So you can imagine if a clot forms in a big vessel and is going back to the heart. It can get stuck in the lungs, it can get stuck in the brain, it can get stuck in the heart directly, and can block off circulation to all those three places. So it's very, very critical if you notice leg swellings for you to go see your doctors. And if you notice any kind of leg swelling with pain, please take it as an emergency for you need to go to see a doctor. And venous thromboembolism is fairly common with Black women. It's fairly common. It's not. It doesn't mean that everybody has it, but it's fairly common. Case in point, someone that we all know is Serena Williams. You know, Serena Williams. Even with all her exercises and top level of activity, these are some of the things that happened, and he almost died during childbirth, specifically because of this condition. So it's critical if you're the woman that regularly gets leg swelling. If you notice any kind of pain, you need to see your doctor immediately. There are scans that can be done and tests that can be done to help prevent this. So, in conclusion, few of these conditions they start at this our age, but propagate on later in life, and some can start beforehand. But I would, I hope that I have helped open up and explain some of these conditions and giving us some insight into how to manage some of these situations and how to prevent catastrophic events from happening. I would like to thank everyone for their time, their patience, and their understanding. And I'll take up any questions available. So thank you. I'd like to hand it over to our moderator, Rotimi, so that he can take over. But any questions, I'd like to take all the questions together before I now answer. Or you can write them in the chat box for me. Thank you.
I do have a couple of questions. Thank you. Thank you. If I can go ahead, Rotimi.
Please
A
go
few
ahead.
people handed over, few people handed over to you, but thank you. First and foremost, thank you, Dr. Moyo, for your time and your effort and everything you brought to light to us. It's very it's very close to us because we fall very well into that category, and it brings it more home and reality that we need to be focusing more on our health. So I think I should just let Amin go before I put forward my question. So Amin, if you put your hand up, so please do go ahead.
Hi everyone.
Hello.
Oh,
I mean, how
all
are
right.
you?
Yeah, I'm fine. I'm fine. Moya, really amazing stuff. I really enjoyed it. Very interesting. And like Joyce said, these are topics that are close to our hearts. And yeah, it's actually close to mine personally because some of the things you touched on happened to one of my family members fairly recently. So I just wanted to say thank you. You're thanking us for listening to you, but we should be the one thanking you for spending your precious time speaking to us. And these are very good points to note. And I can't thank you enough. That's all I wanted to say. I don't really have any questions. I'm quite aware of a lot of the things you've touched on because I had to do some research after it happened to one of my family members. So yeah, I'm fairly aware of most of the things you touched on. And
Well,
I,
well, so the thing is this, you don't need to thank me because, we go way back. We go back to, most of us go back to when we're in our early teens, you know, and this is 20 something years afterwards. If I can keep you guys for another 40 years, that that is that is thanks enough for me. That's the objective, really. That's why I'm here, and that's why when Olamide asked, I jumped at the opportunity and said, look, this is critical for us to know. There's no text needed, and it will be a dereliction on my part. You know, is part of the reasons why I decided to stay back. It will be a dereliction on my part if we're not doing the best, and I'm not educating the people my within my reach the most. It's critical that I educate everyone accordingly and make sure that everything is all right. Because if I don't do that, then what's the point of me acquiring all this information and having all this education? So it's something that I'm very easily grateful to do. It's not a problem.
Okay, thank you, Amini. I think I might as well just go ahead with my question. I think the first one is you touched on a normal HBP, that's the high blood pressure, should remain 140/90 for ages below 40. So now I believe most of us in here are above 40. So are you saying that we still follow within that category of if we're above 140/90, then we're sort of um, hypertensive. Um, in another, if, if based on what you just said, and I think my second question is there any link to high blood pressure and that being diabetic as well? I think for me, it's more closer to home because there is the family history of hypertensive and diabetic. So I think for me, and let me just speak for myself, I know for a fact that I have, based on what you just said, my BP is usually above 140 anyway. So and I have been told that I need to watch it. So I'm making all these health conscious decisions, more proactive at the gym, watching what I eat, cutting down on those asu and suya and all of that, So, so these are the things that I am aware of. But there's another bit that I think I don't know if there's a direct link to, but I feel it might play a part. Is there any sort of a link of stress being playing a part into having all this being diabetic and all of that? So if you can shed more light on those, that'll be great, Doctor.
So it's definitely, I can shed a couple of information that I have now. Once you're above 140/90, the systolic is the higher number, the diastolic is the lower number. So any value above 140/90, you are hypertensive. Now, if you've had those values on 2 or 3 separate occasions, my definite recommendations will be to start you off on an antihypertensive medication. Like I said, it's either you start with a diuretic or you start with a calcium channel blocker. It's critical. Now, the thing is people will tell you, yes, stress. Yes, a level of stress is involved, but my 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 pushback to that is this: we live in a stressful world. Can you stop the stress? If you cannot stop the stress, then you need to be proactive about taking your medication. Now, there are things you can do to help reduce the stress, and those things they are fairly simple, but it's also very difficult to get done. Are you making sure you're getting at least 6 to 7 hours sleep a day? You know, for for people with young children, that can be very, very difficult, especially if you're in the UK, if you're in America. It's almost impossible for you to have 6, 7 hours. In Nigeria, it might be easier. You can go and numb them at their grandparents' house and leave them there for a couple of days. But it's not always the same in when you're abroad. So those regular sleep patterns to help reduce, because sleep is critical in helping us control our blood pressure. But if we're not getting adequate sleep, and the stress level is still there, there's no way the blood pressure will not go up. Now, once the blood pressure is up, the only thing you can do is take your medication. It's only, and that's why I'm singing the mantra. Please discuss with your healthcare provider. Make sure you talk about getting investigations done and starting on an antihypertensive medication. Prevention is always better than cure. Now, the reason is this is, and like you said, is there a correlation? I would not say there's a correlation between hypertension and diabetes, but I would say that there's a correlation between diabetes and hypertension. Reason being, like when we talked about diabetes, that in the end is what we call a small vessel disease. Okay, that means it damages the small vessels. Now, there's no way if the smaller vessels are damaged that the blood pressure will not increase because the body is trying to push. So something that was working at 100% efficiency and the blood vessel gets damaged, and you create a new one that's working about 50% efficiency. The normal reaction is increase the pressure going to that 15%, with the hope that you might get improvement overall. Obviously, so there is a slight correlation between diabetes and hypertension. So it's very likely that if you're diabetic, that you're not properly managed, you will develop hypertension. Now, hypertension alone developing into diabetes will tend to occur if the person becomes morbidly obese. Not just obese, but morbidly obese. Okay? Because those correlations will happen. Once you're hypertensive and you're not morbidly obese, the likelihood of you becoming diabetic dramatically shoots up. But there is no clear-cut indication of hypertension and diabetes. But more and more studies are showing that there's a slight correlation between diabetes and hypertension. I hope I've answered your question, Joyce.
Yes, thank you very much. Thank you very much. Thank you very much for that. I think I've got one more question that I missed off my list. What are the signs of diabetes? I've heard so many stories. It could be dryness of the lips, dryness overall, even when you're drinking enough water, you're still slightly dehydrated, or if you can shed some light as well.
All right. So when we talk about diabetes, the number one thing you always need to look for is the feeling of being always thirsty, even on days where you shouldn't be thirsty. Okay, even on days where you shouldn't be thirsty, you feel always thirsty. Okay, that's a consequence of the increased sugar, the increased sugar in your plasma. Once that happens, because the way the body works is once there's an increased level of glucose in the blood system, there's a chemical pathway that causes you to feel very thirsty. So that is one of the key. The second thing to notice is the increased urination more than normal. What do I mean by that is this, is if you're waking up twice at night to urinate before, and all of a sudden it stopped being twice at night, it's now 4 times at night, that means there's a problem. If you used to go to the bathroom to urinate maybe once or twice a day, all of a sudden it's now 5 or 6 times a day. Those are key signs that you need to be aware of. Okay. Now, for people that there is no family history of diabetes, obviously it's highly unlikely, if they are not morbidly obese, for you to develop diabetes. But in some rare cases, you will develop it. Some people will develop it. They are thin as can be and still develop diabetes. So it's critical that even in these symptoms I've just talked about, they need to take it seriously. The dry lips. So the thing is this: in Nigeria, the dry lips will not come into play because of the significant level of humidity that is around. But you can imagine that in summer or in summer, having dry lips in the UK can be very, very unusual because it's not unexpected. So if you notice that in the summer, obviously that's a red flag that you need to know about. Does that answer your question?
Yes, sir. Thank you.
Please, anybody else that has questions, please, I don't mind if you put them into the chat so that I can be answering them as I'm doing the other questions. Any other questions, please?
I think there are some questions in the chat box. Olumide has some, and Shofu made some. Doctor.
I'm just reading the
Please.
chat. So Shofu has asked, how often should we screen for PSA colon cancer?
So for the PSA, once you are above 40, you must do it at least once every year. Once every other year. Once you're above 40, once every other year. If there's a family history of a prostate condition, then you must do it every year. Now, for colon cancer, the problem with colon cancer is this. The screening for colon cancer is colonoscopy. That means for men, they're going to stick something in to go and look into the colon. Now, dependent on where you are, if you're in Nigeria, that means you're going to have to pay for that. If you're in Nigeria, I would recommend once every 5 years. If you're under the NHIS, if you're under the NHS, they have their own protocol. I can't remember what it is right now, but I remember when I was working there, I think it was once every 3 years. If you're in America, unfortunately, you would have to discuss with your doctor because obviously this is something that is preventative and it might not be routinely covered under your insurance scheme. But if it is, then at least once every 2 years should be is the recommendation. And then for Olu asked if there's any preventative medication we should start considering. Well, I wouldn't recommend any preventative medication because part of the problem is the things that they say are recommended for white people don't tend to work for black people. But there are some things that I've noticed that seem to be very fairly effective. So if you can, intermittent fasting at least twice a week or once a week if you can. That means 16 hours without any kind of food, at least once a week. Yeah, it's been shown overall to help with rejuvenation. So that means maybe you pick up Thursday, you pick up Monday, you wake up, you just drink water till the course of the evening. So from once you've woken up till let's say like 7 or 8 p.m. At night, once or twice a week, has been shown overall to help with intermittent fasting. And then Shofu is also asking, can women screen for breast cancer earlier than 40? The recommendation for Black people is anybody 30 and above should screen for breast cancer for Black people. Okay. Now, if there's a family history, you need to go earlier. So even if there's a family history and the family is 40, that means you need to go earlier than that. Okay. So most there is a this is not peer reviewed. So I'm not going to speak of it as if it's peer reviewed and it's empirical science. But what a lot of my gynecologist colleagues will say is women that breastfeed their babies for at least 6 months tend to is less likelihood that they develop breast cancer, especially if they have their children 30 and earlier. If they breastfeed their children for 6 months and above, there's less likelihood of breast cancer. They're not saying it doesn't happen, but just less likelihood for breast cancer. All right, so Oshole, sorry about that. Oshole, you're talking about the exercise. So the thing with the exercise is this: is vigorous activity. Now, when you want to come and lose weight, it's not only about exercise. Exercise is not the only key parameter. The key parameter is what exactly you're eating. Also, we need to be very, very wary, especially a lot of us that are abroad now. That there's a significant amount of processed foods and processed additives in what we are eating. So the more plant-based foods that we can get, the better. Obviously, so plant-based proteins, um, vegetables as much as possible, fresh vegetables as much as possible, fresh fruits as much as possible. You know, so that means that if you are in a place like America or Canada, the farmers market is your better option than your Walmart. Okay, because even in Walmart, the fruits might look very appealing, but how fresh and how unprocessed are they compared to what you get at the farmers market? Okay, um, like I said, salads, vegetables. So your eforiro must increase, your afang must increase, things like that. I'm not necessarily stopping you from taking your your African meals. I'm just saying reduce the carbohydrate part and increase all the other parts that you can increase. All right. Joyce, you wanted to say something before I interrupted you.
Yes, I'm giggling now, Bill, because I feel like I'm the only female here, but it's fine. I will hold the fort for us women here. But I think there is one question when you touched on breast cancer. Is there any correlation or link with the female contraceptives, so the pills and the others linked to breast cancers? I know there's been a few
So,
writings that have touched on that there is some sort of
so,
correlation or link,
so
but it's
what the
good to
peer
hear.
reviewed what the peer reviewed data is showing lately is showing that any woman, and I include all young girls in this, um, that hasn't got pregnant before should not start on any hormone replacement therapy, should not start on any hormonal based contraceptive until they've gotten pregnant. Or unless you've spoken with your gynecologist and he recommends it as part of your treatment plan for, let's say, PCOS and other conditions. But apart from that, please, 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 please do not, because the thing is this is a lot of the breast cancers, because when we look into the morphology and into the pathology, we realize that a lot of it is hormonal based. About a good 60 to 70% of the breast cancer is hormonal based. All of a sudden, that's why it now makes sense that you see women that breastfeed for longer, that they are they're less likely to get breast cancer. It's not like it's not like they don't get it, but they're less likely because that during that breastfeeding period, the hormonal level stays balanced because the mother has to breastfeed. The mother has to breastfeed. So the pathways that cause breastfeeding pushes down the regular hormones. Okay, so that guarantees a period where all the body system can rejuvenate. Now you can imagine the young female that is just growing, and you now start manipulating the hormonal levels. It's a recipe for disaster, and that's what the studies are now showing. That young women that have not gotten pregnant before try alternative contraceptive means, or unless your gynecologist recommends it. So they're showing some correlations, especially with the breast cancer, especially with the ovarian cancer, and yes, and as much as possible, because all of us are going to have children, we need to we need to be wary about the vaccines that we give some of these children. For the cervical cancers, the HPV um, the HPV virus has been shown to be a big part of the cause of cervical cancers in females. The majority. So if we look at the spread of cervical cancer, that is cancer of the cervix. For us non female part, not female part of the district, that's the part of the woman's genital system. So for cancer of the cervix, human papilloma virus is a known causative agent that has caused a significant percentage of cervical cancer. So we need to be wary about which ones that are more common, and obviously, um, um, allowing our young female children to coitus early can be a problem because it's been shown that the earlier the coitus, the increased likelihood of cervical cancer. So it's something that we need to worry about. Thank you. Any other
Thank you.
questions? Hope I've not bored everybody away like this because it's like I've been
So
talking and
not for me though.
Maybe there's still more questions on the. I don't know whether you're taking everything.
I'm taking everything.
Did I mention? Okay, yeah, I think you're taking everything.
Okay. If there are no more questions,
Sorry, Dr. Eviti. Well, once again, thank you very much for your suggestion. But there's one aspect you didn't touch on, and that was which you are now you are now specializing in terms of eye care. You didn't touch on that. You know my personal effort to that, so give a little bit on that.
So the thing is this: most patients will not commonly have issues with their eye until they are in their late 40s, early 50s, even early 60s. Now, the late 40s, the ones that have issues with their eyes in the late 40s tend to be the ones with comorbidities. They're hypertensive, they are diabetic, they never knew, and they're not taking their medication. So they develop complications that will cause eye problems. So that's why I did not sit on ophthalmological issues alone. Even if you want me to talk about ophthalmological issues, we will do another presentation, and I'll go in depth into how diabetes affects the eye, and it can be quite in depth. Trust me. or how hypertension can cause the retinal detachment I spoke of earlier. So there are a lot of conditions that comes into play, but the idea is to educate our family on the commonest things they need to watch for and how they can be proactive in making their own decisions, especially with doctors abroad that are not always going to take them seriously, or they're not always going to be as aggressive as they can or should be for them. That's why I've done this. It's not because I only want to talk about this thing, but to also educate you. Like I said, I spoke about when you're dealing with hypertension, the diuretic and the calcium channel blockers. It's something that you might not remember now, but that's why we put the presentation in the group, so that if you notice, you can talk to your doctor and be like, oh, my doctor friend in Nigeria says, look, calcium channel blocker diuretic, why am I not on any of this medication? Why haven't I done a kidney function test? These are things that are critical in the way diseases are managed. Same thing with diabetes, so it's very, very important, because or else you're going to find out that, okay, someone is in their early 50s and is dealing with heart failure, which it shouldn't be the case, because most white people won't even get close to heart failure to their 80s or 90s. So why is it that they're allowed to drop the ball when it comes to our own healthcare? And that's just because most of us don't know, and we're not aggressive enough about voicing for what we need. So the whole point is to educate, and is to give you some key instruments so that you can fight back and push for things that will benefit all of us in the end. And if you're in Nigeria, you always have me. You can always pull my ear for any discussion.
And we are not in Nigeria, Uncle.
Yes, I've already been pulled already. That's that.
I don't understand, Oshole. How many times you want me to start talking? How many times have you messaged me about something? About this children? Have I denied you before?
You tried, you've done well.
So it's just that
Thank you.
It's just that if they're in Nigeria, it's easier for them. There's no time lag. There's no issues. You that you are abroad now, you might have to think, oh, what time in the morning do I have to call Boyo? What time? But here in Nigeria, they can call me at. If I'm in the theater, I can just be like, okay, call me at this time. I'll be out of theater. All right, everybody. Thank you very much.
Absolutely. Yes. Thank you, Dr. Moyo.
I think
we've got one or two nuggets. Even if it's one or two nuggets from this session, I think my case is denial. I'm in a denial phase, and I think there is this phase in one's life, especially when you cross that 40, and you need to do certain things, but you just in that denial phase. And I think maybe this has sort of helped. I don't know about others, but it's helped me. And then I need to go back and do those tests that I've been asked to do. And but yes, thank you once again. And I believe I need to say thank you to Umutuga and Rotimi for setting this and pushing for this thing to happen. And just as a reminder to others on the call that we will be having other sessions. Umutuga, please correct me. And we'll be having another session, another webinar on finance. And following that, we will. Yes, he's just confirmed that. So yes. So thank you once again for your time, and please stay tuned. Though we have other stuff that we're planning for our reunion and our 25th year of togetherness. Is it togetherness or since leaving? She's leaving our famous school. So yes, do have a pleasant evening, and catch you all soon.